Clinical documentation improvement plans. As an HIT professional, you are responsible for the most up-to-date information regarding the latest technology and healthcare standards. Clinical documentation is a key healthcare standard that needs to be maintained and improved upon constantly in order to provide the best patient care. Improving the accuracy of clinical documentation can reduce compliance risks, minimize the facility's deficiencies and errors during audits, and provide insight into legal quality care issues. Clinical documentation is what pays the bills in the long run. Without proper documentation, we will not be reimbursed correctly. Clinical documentation should be as complete and as specific as possible. It should include information such as the level of severity, specificity of the anatomical sites involved, and etiology of symptoms. Every successful plan begins with implementing policies and procedures. Policies to be included but are not limited to education, experience, initial orientation and training, ongoing education and training, compliant query practices, and clinical documentation quality assurance processes. Clinical documentation improvement professionals can help you achieve and complete accurate documentation by educating members of the patient care team and others involved in the patient cases regarding documentation guidelines, teaching about clinical documentation requirements as they relate to the classification systems, MSDRG assignment, and clinical conditions and treatment needs of the patient. Retrospective reviews provide clarification of indistinct, conflicting, or incomplete documentation. CDI professionals consist of a team of HIM professionals, which consist of registered health information administrators, registered health information technicians, and certified coding specialists. Also on this team are registered nurses, physicians, physician assistants, and other providers. The query process. A query is routine communication an education tool that is used to gain complete and compliant documentation. The communication can include verbal and written queries, whether concurrent or retrospective. Situations commonly addressed by a query include presenting clinical indicators of an undocumented condition, requesting further specificity of the degree of severity of documented condition, clarifying a potential cause and effect relationship, and addressing present on admission issues. In conclusion, if we all work together and have open minds, we can achieve complete and accurate clinical documentation.